All right.
Greetings, friends and followers. This is Nurses Talking. I am Dale Barcy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. And today it is my pleasure, my great pleasure, to welcome Alexandria Jones-Patten. Alexandria is a PhD prepared registered nurse and a health writer. She has patient care experience in street medicine, serving populations experiencing homelessness in Skid Row, Los Angeles, and in cardiovascular care in the hospital setting. Her research explores racism, discrimination, and mental health among African Americans. Most recently, she has published research in Clinical Nursing Research and Journal of Substance Use. Alexandra received a PhD in nursing from the University of California, Irvine, and she has also earned a master's degree in both nursing and business administration. She's currently working as a postdoctoral research fellow at Columbia University, focusing on developing an intervention to combat racism and discrimination among older adult Black women at risk for cardiometabolic disease. When she's not working on research, she's a freelance writing for companies like Health, MedPage Today, and WriteRN. So, welcome, 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 Alexandria.
That was the most awesome introduction. Thank you.
You know, I think that nurses deserve awesome introductions. So there.
Thank you. Thank you so much.
It's my pleasure. And thank you for doing this.
Of course. So happy to be here.
The first thing I always want to know from people is why they're nurses. So why are you a nurse?
I always dreamed of becoming a nurse. Initially, I thought that I would be a medical doctor, but my high school actually offered a CNA program. So I had the opportunity to graduate being a certified nursing assistant. And I took the scenic route, I like to call it, to get to where I'm at today. But I always had an interest in health and certain body systems like the cardiovascular system. And I wanted to learn more and be around people who were, needing help in that area. So I'm right where I'm supposed to be.
Okay. So given that that is something you always wanted, when you came to it, was it what you thought it was going to be?
Yes and no.
Okay.
Nursing is, well, let me even back up. Applying for nursing school, I tell people, anyone who will listen, I failed anatomy and physiology 3 times. I failed general chemistry twice. I was fortunate enough to be able to apply to nursing school just across one academic year and get in, but I applied to about 5 or 6 different schools and only got into one. And I applied as someone who had already had a bachelor's degree in another field. So that was challenging. And then you get into nursing school. I was in a nursing program that had primarily minority students, racial minority students. So when you get out of nursing school and you see that this is not the norm, that was a little bit of a challenge. Only because I didn't realize that people I took care of and family members of people I took care of may not always take kindly to the fact that I may not speak their language, or I may not present the way that they would like for me to present so that they feel comfortable while they're in this really vulnerable state. And you do your best to meet their needs. The priority is always patient safety and making sure that people feel comfortable and safe with you, right? Because you have 12 hours with them.
Yeah.
That is a challenge sometimes. I found that to be a challenge. And I also found that what I really enjoyed the most was the patient education. But there was so little time to do that because you're so task oriented at the bedside, right? We're trained to immediately go into bedside nursing, which is fine. But it wasn't quite what I expected it to be, in that moving up may not be that easy. And then also
Yeah.
finding your place. I had a really hard time finding who I was. I knew that I
Yeah.
loved educating people, and I knew that I wanted to go into research at some point, but I didn't know how to get there,
How
what
to,
to do next.
And, and those are some of the things that, as you said, nursing school focuses a lot on hands-on and completing tasks and stuff like that. But,
Mm.
Nursing is so big and so broad.
Yes.
Um, I don't know how we would incorporate some of the wider aspects of nursing into nursing education, but that's one of the things that many people tell me they find challenging, is that once they get out and get into the profession themselves, they just don't know how to navigate into areas that probably are more suited to them.
Exactly.
Yeah,
Exactly.
and that's kind of difficult. So you said that you worked on Skid Row in Los Angeles.
Yes.
Tell me about that, because I see that. I looked at that and I thought, oh my, how, I'm sure it wasn't exciting for them, but how exciting.
So I didn't start there. So I worked as a telemetry nurse in California for 3 years prior to that. And I had just entered into my PhD program, and I was ready to leave the bedside. And I knew that I didn't want to retire from the bedside. So I was quickly trying to figure out, okay, what else can I be doing now? In nursing school, they always tell you, oh, you got to get, a year or 6 months or 2 years or 3 years or 5 years, depending on what it is you want to do
Yeah,
next.
yeah.
And I found myself unofficially being in the public health nursing realm through my research. So one of my mentors at University of California, Irvine, who does research, she had some research teams that were working in Skid Row. And it snowballed from there. I started as a student researcher just working to conduct research. But then I found myself connecting with another person who ran a major clinic in Skid Row, who's also a nurse practitioner, who was looking for registered nurses to come in and work per diem. And I said, oh, this would be perfect. So I came in and finally got a taste of working in the clinic setting. That was always a setting I had wanted to try. The
Uh-huh.
beautiful thing about hospital nursing is that you have those 3 12-hour shifts. So it's really hard to get away from that
Yeah,
once you get into it, because
yeah.
I've got 4 days. I don't, I rarely have to put in a time off request. In Skid Row, I found it to be fun. There's a lot of minorities that we serve, not just racially, but minorities in the sense that there are people dealing with mental health issues, there are people dealing with substance use issues, there are people who are dealing with issues with access to care because of their housing status, and they want help. And sometimes they know how to seek it, sometimes they don't, sometimes they know what to ask for, sometimes they don't. And I got a lot more of that opportunity to educate that I had not been able to get at the bedside during that single 12-hour shift.
Yeah,
And I
yeah, yeah.
enjoyed it. Street medicine is fun. Street medicine, you never know what you're gonna get. And I never thought that I was one to do emergency medicine. So I thought clinic and street medicine, street teamwork was the nice balance. Like, yes, I've done some things that, require quick thinking and are emergency situations, but there's not blood gushing everywhere and somebody who needs a ventilator
Uh,
immediately. And, you're not the
yeah,
only one in the room. Like, there are
yeah.
people around you. So I found street medicine to be extremely fun. And I got there through research.
Cool. Really, really cool. So you mentioned just now, as you were talking about it, you mentioned that you had the opportunity
Mhm.
to educate. But I have to wonder, these are people who have had multiple different kinds of experiences.
Mhm.
So what, if anything, what's the biggest thing you learned from them?
Because of the population that I served, because they were um, primarily African American, I didn't understand at the time that it really is important for representation. Having
Mhm.
somebody who looks like you kind of lowers the barriers or some
Inhibition.
of the hurdles that people feel when they are trying to access care. And I had always had some experience and feelings with that, just personally
Yeah.
seeking care, before becoming a nurse, while becoming a nurse, after being a nurse. I truly, I try not to tell any of my providers that I'm a nurse, because I just never know what way it's going to go. But
Yeah.
one of the biggest things that I learned is that you have to have a rapport, and you have to figure out how to start somewhere with building that
Mhm.
rapport with people. And it's really hard to do that in 15 minutes. It's a little bit easier to do that in 12 hours, but even
Yeah.
then, that takes, a lot of work and being consistent, making sure that you're showing up for those hourly rounds. But in the street and in clinic settings where there's multiple people coming up to you with needs, you have to be able to build a rapport quickly. They have to trust you. And, one of the ways that people were trusting us was because they knew that they saw us in scrubs. So they felt like, okay, she's in scrubs. She's not wearing a white coat.
Yeah.
She looks like me. She's a
Yeah.
woman. Maybe
Yeah.
I can talk to this person, and maybe
Yeah.
I can get what I need medically.
Yeah. Yeah.
It's
Yeah.
meeting people where they are.
Yeah. Yeah. That's awesome. And that sometimes is a hard thing to do because you
Very,
first have to recognize where they are.
very, very hard. And yet you have to
Mhm.
put yourself in their shoes. I don't wear a hat or a shirt that says I'm a registered nurse. So you wouldn't
Mhm.
know who I am and what my background is if you didn't talk to me. So I too, I have issues sometimes going out
Yeah.
to people and telling them what I need, even in a medical
Mhm.
setting.
Mhm. Mhm. Got it. Got it. Got it. So one of the things I want to know from nurses, because we talk a lot about how frustrated we are, how overwhelmed we are, and
Mhm.
all of this thing about where nursing is right now. And I believe I get the things that people complain about. I do, but I believe that a lot of it has to do with us ourselves. And
Okay.
I don't think we articulate well what we would like to see change and how we think it can be changed and how we could go about changing it. So what do you think you would like to see change?
Ah, that's a tough question for me because I'm a millennial and I know people talk about us bad.
Yeah.
And I know that people talk about us bad because we are kind of that starting generation that's shifting how much disrespect or support or lack of support we're willing to handle before we walk away. I think that in order for us to see change, we have to really start to band together. And there are several issues that continue to be discussed. Nurses everywhere are starting to talk about mental health. They are begging for better access to mental health. And unfortunately, for a lot of nurses, and I feel as though this is not just nurses, for nurses, physicians, respiratory therapists, anybody who's working a 12-hour shift, an 8-hour shift in these really demanding settings, we're starting to demand mental health access, and a lot of people are not getting it. We're
Yeah.
also starting to see that nurses of most ages, most age groups, I feel, are really starting to say, okay, the way that I'm treated by management, the way that I'm treated by my patients, by physicians, by patients' family members is no longer okay. I don't want to tolerate this. And part of the
Yeah.
problem is that we're not there yet where we have enough of a voice and enough of an impact to demand that change. It's slowly happening, but just like with politics, everything takes so much time. I'm from Oregon and I've never practiced in Oregon, but I was so excited to read that Oregon nurses finally are going to have nurse patient ratios. It's going to be mandated next year. And I
Yeah.
said, wow, that's amazing. But then at the same time, I said, this is the second state to do this, and California has done that forever.
Mm-hmm.
Out of
Mm-hmm.
California, I've never had an issue. I think only once have I had an issue with having to go out of ratio. And it's a safety issue, right?
Yeah.
But we're
Yeah.
still having these really long, intense conversations demanding that hospital management treats us better. And I think one of the issues that one of the issues that comes with that is that we're having a hard time figuring out how to band together and clearly state what the issues are and what we're willing to do if these issues are not resolved.
Yeah. I'm actually glad you said we're having a hard time figuring how to band together, because when you talk to people and people look at nursing and they say, well, you have unions and you have organizations and we do have all of these things, and all of these things are valuable and good, but clearly we're not doing we're missing something.
Well,
Clearly. Mm-hmm.
I think too, when you look at, American Nurses Association or even some of the minority nursing associations or some of your state and local associations, you still have to understand that there's issues locally, and every region, every city, every state will have separate issues. So,
Mm-hmm.
Part of the problem that some of these national organizations are dealing with, I think, and I think they're trying as best as they can. They're trying to be broad and handle these issues, from a broad perspective, which makes it really tough when
Mm.
the organ nurses are fighting for staff ratios, but then let's say, Minnesota nurses are fighting for mental health access. Well, which one takes the
Yeah,
precedence
yeah,
when these national organizations are making a statement? Which one
yeah,
matters more?
yeah. Wow. It's a big job
It's a
getting
very
us
big
there.
job, and it's, I don't think it's any one person's job or fault
Right.
of where we're at, but it's going to take a lot more banding together, a lot more unionizing, a lot more grassroots organizing to figure out how to tackle these issues. And there are some states I've seen lately that are starting to put more dollars towards getting nurses trained to become registered nurses and opening up the doors to get student nurses in, and then also actively recruiting for academia nurses,
Yeah,
because there
yeah,
are states that are, incredibly shorthanded with
yeah,
being able to teach nursing students. Well, if there's no
yeah,
one to teach them, then that's part of the
yeah,
problem too.
yeah. And somewhere in the education, incorporate our own self-worth, our worth, because I feel like we don't really know our worth. We will all say that we're the backbone of healthcare, but I don't think we actually really know what that means.
Mhm. We get the annual, we're the, what do they call us, the most trusted profession,
Yeah. Mm-hmm.
and that puts so much more weight on us than
Yeah.
I think we realize. And
Mm-hmm.
we go from being like, of course, this is me, to, oh man, now I've got to keep holding that title. I've got to keep
Yeah.
proving that I'm trusted. Well,
Yeah.
but what about my own needs?
Yeah.
What does that mean? What does that look like? And how am I getting that? And who am I getting it from? Where am I getting it from?
Yeah. Exactly. So piggybacking on that though, that we're talking about, in the last 10 to 15 years, I have been a nurse for like 49 years now.
Oh,
Um,
congrats.
Thank you. And I've been fortunate enough to work A, in different specialties, and B, in different countries. But in the last 10 to 15 years, what I have seen is that nursing has really exploded. And we're recognizing that nurses can and should and are everywhere. They should
Mhm.
be. We can be everywhere.
Yeah.
Given that explosion, what do you see in about the next 10 years or so? What do you see, or what would you like to see?
What I'm currently seeing is a lot of nurses trying to figure out what other, not necessarily side job, but what else they could be doing in addition to bedside
Mhm.
nursing. And I love
Mhm.
that for us. I love that for us.
Me too.
I'm seeing a lot of nurse influencers. I'm seeing a lot of nurse business owners. I'm
Mhm.
seeing a lot of nurses in management, nurses creating their own jobs, their own
Yeah.
pathways. And I'm
Mhm.
hoping that that will continue in the next 10 to 15 years for sure. I'm also hoping that we get to a place where we can agree on things like the safe patient nurse
Mhm.
staffing ratios. I'm praying that we can get to a place where we can agree that nurses and physicians and healthcare workers in general need better access to mental health. They need better access to breaks during their shifts.
Yes.
They need resources to continue to be those most trusted professions
Yeah.
that America sees us as.
Yeah.
And I think we're going in that direction, but again, it's going to take some time. And I would love to see more nurses utilizing their license for other job opportunities. There are so many opportunities. I do freelance writing on the side,
Mhm.
and I absolutely love it. I get to, again, educate, but
Yeah.
educate for a more general audience. And I get to educate on what I'm interested in, not just what my patient came to me presenting
Right.
with.
Exactly, exactly, exactly. That's huge, being able to do that. So your research and your postdoctoral research, you're talking about racism,
Mhm.
and you're particularly focusing on older Black women. Why them?
So that's one of the current research studies that I'm on. So as a postdoctoral research fellow, my job is to really find other nurses and other research leaders who are doing the type of work that I'm interested in. I'm really interested in racism and discrimination and how that influences cardiovascular outcomes among Black adults. It
Mm-hmm.
just so happens that one of the studies that we're working on is primarily focused on Black older adult women who are at risk for cardiometabolic disease. My goal is to create an intervention at some point that's similar to American Heart Association's Life Essential 8 that
Yeah.
really focuses on discrimination and racism and how to combat that from a minority standpoint. I think that's one of the key pieces that's missing when we're talking about heart health. I also think that we need to have a better conversation about mental health, because if we're talking about racism and discrimination, we have to talk about the mental impact or the mental influence that is happening there and how these combined factors
Yeah.
play out in heart health, blood pressure, heart failure, heart attack, stroke, all of it. It's interconnected. And
Yeah.
we still have a long way to go in that area. So I'm excited about the research, and I'm hoping that, as we have more and more conversations about specific populations that may be affected, we can start to talk more about a more broad audience of people who
Mm-hmm.
may also
Mm-hmm.
be affected by
Yeah.
these constructs.
Yeah, 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 yeah. Yeah, and I'm glad that you enumerated those things, because very often people see racism as racism, but they don't see the ripple effects of how how it affects you, and how deeply
Mhm.
it affects you, and don't even connect what that happened with this. So
Yes. My dissertation, I had a qualitative study component to it, really asking people about their specific experiences with discrimination. And it almost saddened me a bit to listen to some of the participants say that they didn't even realize they were experiencing discrimination. And there are so many different types of discrimination, and they just
yeah,
had no idea that, oh, this was not fair. And I didn't
yeah,
even know
yeah.
it. So therefore I couldn't even combat it. I couldn't fight it.
Exactly, 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 exactly. We have come to it has become part of the norm. We've come to expect it,
Yeah.
and expect it to be part of our norm and not even recognize, not
Yeah.
even recognize. And from both, from the person who's receiving it and also from the person who's perpetrating it.
Hmm.
Very often both don't even recognize.
Exactly. Exactly.
Yeah. So I have come to after all these years, I've come to realize that I can recognize nurses without them telling me they're nurses. Not every time, but
Really?
very often I can recognize that somebody's a nurse. And I started wondering, A, what was it that I was recognizing? What was it that made me
Yeah.
think that this person is a nurse? And B, do we all recognize each other? Can we recognize each other? And so I started asking then, if what is this most essential quality of a nurse? And if you could describe it in just one word, what would that word be?
I would say they have to be caring, and that sounds so cliche, but it's true. And it's true for a number of reasons. First of all, it's incredibly tough to take
Yes.
care of strangers
Mm-hmm.
because you don't know who they are and what may frustrate them or upset them. Second, you always, not always, but you sometimes hear people saying, oh, nurses are making such great money. Not as much as you think that we are. I
Yeah.
remember just recently, I just moved out to New York from Los Angeles, and I went to a nursing event here, and there was a new grad nurse who was saying something about their salary, and they were just making over $100,000. And to someone who's living, maybe in the South or, maybe in the Midwest, $100,000 seems like a lot of money. Then I thought about how much I made as a new nurse, and
Mm-hmm.
California is definitely one of the better paying
Yeah.
states, regardless of how many years of experience you have. And I just thought, man, okay, this nurse is making, a couple of,
Uh-huh.
10,
Mm-hmm.
20,000 more than I was making
And you did. Yeah.
6 years ago as a new nurse. But at the same time, this is 6 years later where
Right. Yeah.
inflation is so much higher, and they live in a city
Yeah.
that
Mm-hmm.
costs even more
Yeah.
than
Mm-hmm.
the city I was living in when I started. So I said, oh my God, like you can't
You can't
afford more
afford.
than like a $2,500 a month apartment. And yeah, try
Yeah.
finding that in New York City. Like,
Yeah.
that's insane. So
Yeah.
I really do think that it takes a special type of person to become a nurse, because you never know what you're going to get. You never know who is going to come in with, a bone to pick, and it has nothing to do with you, but you end up in the crossfire. And I love the fact that we can take care of others, and that we can heal them holistically, but that takes a special type of person to do that. It's
Absolutely.
there are no metal detectors at work. There are no,
Right?
boundaries to
Yes.
stop somebody from harming
Yeah.
me. But
Yeah.
then, at the same time, it's you have to really enjoy, again, taking care of someone holistically. They come in with a medical condition, but they're going to come in with some other issues, and it's
Yeah.
your job to build that rapport and help them help themselves when
Yeah.
they are discharged.
Exactly. 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 So what advice would you give to someone who wants to be a nurse, who's considering, especially in these times when we're hearing so much, and they're like, well, I wanted to be a nurse, but I'm not so sure now. What would you say?
I would still tell them, do it. I hope that this interview, I don't come off as someone who's like skeptical of being a nurse. Nursing is a beautiful
Mm-hmm.
career.
Mm-hmm.
Nursing takes a lot out of you, but whatever you put in, you're going to get out so much more if it's positive.
Yeah.
You have so much flexibility. You have a career, not just a job. You are able to step away from the 5-day work week if you want. You get so much reward out of teaching someone how to take care of themselves beyond the bedside. You get so many opportunities to work outside of the bedside. And I don't know any other career that's going to give you just that much freedom and flexibility.
Yeah. And knowledge. Because what you realize is that once you have come out of nursing school, you've graduated, you passed your boards, you come out of nursing school, and you realize you've just begun to learn.
Yeah,
All of those things
exactly.
that time and energy and whatever that you put in, yeah, that was important, but you just begun to learn.
That was the easy part, the
That
NCLEX, right?
was
That's what no one tells you. That was the easy part. Now you
yeah,
have to go out and be an adult and
yeah,
figure out what your purpose is in this field. What is your role, and what are you
mm-hmm,
going to do to get there?
mm-hmm, exactly, exactly. So, lastly but not leastly, the thing I talk to nurses about, or I always bring up, is the notion of self-care.
Mm.
We're talking a lot about it these days, but it's one of the things that we tend to gloss over. And we keep still putting ourselves somewhere, I don't know where, maybe not even in the equation. So, what does self-care mean to you?
I am the self-proclaimed queen of self-care.
All right.
Let me tell you, before I moved to New York, and I actually took a pay cut to transition into academia, but I
Mhm.
think it'll be worth it. But prior to this, I was getting massages every week. I was getting my nails done every 2 weeks. I was taking myself on dates, and I still do these things, but I think it's so important to treat yourself. And that was one of the biggest lessons that I learned right in the beginning. I can take care of everyone else, but who is taking care of
Yeah,
me? And
exactly.
I can't put into you and not put back into myself. And so now my priority is other things that cost a little bit less money, like exercising. I ran track for a really long time. So,
Mhm.
and I love the gym. I really do. So one of my goals is to at least 4 to 5 days a week get in the gym, or at least give myself 30 minutes a day of just time, whether that's exercise or finding something where my brain can rest. Because again,
Mhm.
even outside of the bedside, I can only do so much and be so progressive if I don't have that time for self-care. I find
Yeah.
myself a lot less proactive and
Yeah.
productive when
Mhm.
I don't have anything left in the tank.
Yeah, yeah, yeah. And you said don't have anything left in the tank. And I think that sometimes we don't realize when we don't have anything left in the tank, we are going on, in overdraft
Yep.
and don't even recognize that we don't really have anything left.
Well, and we're taught that, and it's not that nursing school is bad, but we're taught to keep going and to constantly be taking care of
Yeah,
others and critically thinking and making
yeah,
sure that everyone else is safe. But we have
yeah.
to take that same attitude and put it and turn it inward.
Yeah, yeah, yeah. I spoke to a nurse a few months ago who really impressed me with that, and I keep everyone now I find myself referring to her when I talk about self-care. But she truly impressed me with that because she had come to the realization that she needed to care for herself a little bit better than
Mhm.
she had been doing. And she made a vow. She made vows. She wrote vows, like marriage vows, that she that she vowed to herself. I thought, okay, what if that's what you have to do? That's what you have to do. But, you know, sometimes it takes that much for us to recognize that we're leaving ourselves out of the equation.
Oh yeah, it's a
Yeah,
mindset shift, and if
yeah,
you can't figure out how to shift your mindset, you're forever going to be in that space of
you
everyone
are.
else before yourself.
You are. Yeah, yeah, yes, you are. Alexandra, before we go, is there any gem you'd like to leave us with?
Oh man, that is a great question. For anyone who is thinking about nursing, again, I say do it. For anyone who is in nursing and loves their job, I appreciate everything that you do. Keep working, find some new nurses to mentor because some of us need help. Uh, for any nurses who are kind of struggling, especially those who are at the bedside, come talk to me. I would love to talk more to nurses about being a health content writer. I just wrote an ebook on why you should think about using your license to leverage more income by being a health content writer. So I think that sums up what I would say to any of my nursing community.
All right. Well, you just mentioned that you wrote an ebook. Do you want to tell us what it is?
I
Someone might want to.
did. So it's called Beyond the Bedside, Ignite Your Nursing Career in Health with Health Content Writing. It's on Amazon. Happy to send you a
Okay.
link. Happy,
Sure,
happy,
we can put it
happy.
in the description in the description box.
I appreciate that. Yeah. So
Of
my goal
course.
now that I've been a health content writer for a little bit, boy, is it hard, and boy, are there few resources to help you get started. And I don't mean
Yeah.
hard in the sense that you can't do it or that it's impossible or that you need, a specific person or a specific amount of money, but it takes time and persistence. And I've learned some things through other nurses who have their own content writing courses, and it's been amazing. But I also have some things that I want to add to that conversation. And
Awesome.
we
Awesome.
need more nurses who want to do some health content writing. You don't have to run away from the bedside, but maybe you take a day off and you do some health content writing. Let's talk about it.
Yeah, let's share this thing. Let's share this thing. Thank you so much, Alexandra. I've truly enjoyed this conversation. Really, I have. Thank you.
Thank you.